again for joining us today. We are now recording the webinar. I'd like to introduce our speakers today. We have two researchers from UBC. Jennifer Black is the Associate Professor of Food, Nutrition, and Health in the Faculty of Land and Food Systems at UBC, where she leads the Public Health and Urban Nutrition Research Group and teaches courses related to applied nutrition, land, food, community health, and research methods. Seneca Elliott is an Associate Professor of Sociology at UBC. Her research interests lie broadly in the areas of family, social inequality, and social policy. She's the co-author of the 2019 book, Pressure Cooker, Why Home Cooking Won't Solve Our Problems and What We Can Do About It. So I'm going to pass it over to them, and I will stop sharing my screen. And I can't wait to get started. I'm so excited.
Thank you so much, Addie. I just shared the screen and Jennifer is going to get us started.
Thanks, everybody. Hopefully you can hear me. I realized I just started talking while I was muted, but hopefully you can hear me now. I just wanted to start by saying thanks so much to Farm to School for giving us the opportunity to share our work with this audience. We'd also just like to acknowledge that UBC's Point Grey campus is located on the traditional, ancestral, and unceded territory of the Musqueam people. Work and research related to the role of food access is particularly important in the area of COVID-19 and this month's actions to address systemic racism. So we hope this historic moment will help us shed a light on collective approaches to ensure that all children have access to the food and care they need to grow, learn, and reach their full potential. As we'll discuss throughout this talk, food is about more than food, and school lunches can serve as one way we show our care for each other in good times and times of challenge. This project that we're going to talk about gives us the chance to learn about the meaning of food in the lives and school experiences of children. And although school as we usually know it is not fully in session right now, we hope insights from today will help inform the creation of future food systems that will better serve all of our children in the years to come. So we're going to describe emerging findings from a research partnership that we forged between our UBC research team with Rachel Engler-Stringer from the University of Saskatchewan, with whom together we partnered with a health authority and a school district in a suburban BC community. So we'll be talking about we a lot in this talk, and when I say we, I'm referring to the entire academic research team, including our research assistants. Our partnership was originally formed to document and assess the process of implementing a new school lunch program in one school district. And while many of you likely know which district we're going to talk about today, we're choosing not to actually name the district. We want to keep our attention focused on the broad themes and lessons that emerged rather than on the specific details from that one district's specific context. But what we'd like to do is use this initial work to shed light on the kinds of questions we need to be asking about why we should care about school lunch in Canada. We'll explore several common reasons put forward by school districts and advocates like many of you today for the importance of investing in school lunch. And here we'll describe two types of models that were used in this one district. We'll reflect on what we can learn from students' experiences on the ground, and we'll describe what actually happened when a new program was put into place. We've been learning a lot of surprising lessons, and we'll discuss some of the things that we learned about how food is more than just food to kids at school. To whet your appetites for what's coming, we'll highlight what we learned from school lunch about how children experience stigma, how they see themselves through the food they eat, the importance of price and access to school food, challenges to the notions of universality, and how food experiences are tightly bound up in how children can feel cared for, or in some cases not cared for at school. We hope we will also have a little bit of time for discussion about what this means for how we should frame the wider value of school lunch as part of the way public institutions collectively care for children in Canada. To fill in some very brief background about the national context, Canada doesn't have a national school food program. This makes Canada a rarity among wealthy nations. It also means that there are concerning gaps in school food provisioning in Canada. Given this, there have been growing calls and attempts to pull together the evidence on the potential value of school meal programs and advocacy efforts to move the federal government towards establishing a national school food program. The Coalition for Healthy School Food, for example, has been making the case for a national school food program to enable all students in Canada to have access to healthy meals every school day. And Food Secure Canada's recent action plan for food system renewal following the COVID-19 crisis that some of you may have seen recently released now calls for a plan to immediately advance a national school food program as promised in the federal budget 2019 and in the food policy for Canada. So there are lots of good reasons and evidence to support the value of a national school lunch program, but as many of you probably know, there are several different kinds of arguments made to support advocacy around school food programs. We've listed just a few of the most common ones on this slide. In Canada, suboptimal dietary quality of children is a major public health concern. Work led by Claire Tougault-Lafleur from my own research group has examined national dietary data using data from the 2004 and 2015 Canadian Community Health Surveys, and her work has revealed several areas of concern in school hour dietary intake of Canadian children from across all socioeconomic levels of the spectrum, even though the majority of whom still report bringing lunch from home. And while we have documented small improvements in school hour dietary quality nationally between the 2004 and 2015 national surveys, it's worth noting that in 2015, children from food insecure homes where families lack access to food because they can't afford it, had lower diet quality scores compared to their peers from food secure households. But that wasn't the case back in 2004. So this is really a troubling sign that some argue could be improved with universally accessible school meals. So we care about healthier food and also the potential benefits of school meal programs for reducing the severity of food insecurity for households with children. And that's significant given that at least 1 in 6 children in Canada are affected by household food insecurity, and those are estimates from before the COVID crisis. So there's evidence that school food programs positively affect not only school attendance, but also academic achievement. Other arguments include school meals' potential benefit for busy and time-strapped working parents, particularly for mothers who are still most often the ones tasked with the responsibility of ensuring healthy school meals. But it's not all roses. Some studies find that school food programs can reproduce inequality, entrenching a sense of stigma for program users. And many questions remain about how school food programs are actually experienced and used by the students and families themselves. So this is what we're going to focus on today, some of our findings from a BC district that phased out a previous school meal program to implement a new program that was framed as a cost-shared, universally available program. So to tell you a little bit of the context of this work, it brings us to our case study that really got going after this district passed a motion in 2017 that directed its staff to provide a report by 2018 on the steps and costs that they could take to roll out a district-wide plan to address food insecurity and healthy eating that will make available food programs to all of their schools so that no child is hungry and every child eats healthy. Our research team came on board and got a small grant from the Social Science and Humanities Research Council of Canada shortly after. And by 2019, a district nutrition coordinator had been hired, an external caterer had been found, and the program launched in 3 schools in 2019. As part of our partnership we formed with the district, we were in the room to learn firsthand about a lot of the decisions that were being made in the district as they established and then launched their new school food program. And we wanted to capture the rollout of the program from diverse experiences, including the voices of parents, school district staff, and particularly from the children themselves. So first we said, let's document what's happening at lunch. So we focused on the 2 elementary schools and 1 middle school where the new program was going to be piloted. We wanted to know, what does lunch look like? What does it smell like? What does it sound like? What does it feel like? So in addition to writing detailed field notes, documenting the setting and experiences of school lunch, we also took photos of students' meals, which you're gonna see throughout this talk. We asked a brief series of questions to all of the consenting students. We conducted this field work in the oldest grades from the 3 schools, selecting 2 classes in each school, each of which we visited 3 times before the new program was unveiled and again 3 times after it was underway. All of these schools had existing lunch programs, so we had this opportunity to compare. And just to note, we had ethics approval from UBC and the school district, and our findings reflect data we collected from 70 consenting students. We also met with our project partners, typically about once a month between the summer of 2018 and the summer of 2019, with occasional meetings since. We received permission to write detailed notes, what we call here process notes, of the meetings to document the decision-making processes behind the scenes. There was a lot of discussion about the problems with the existing program in our early meetings, but none of the key actors involved in developing the new program knew what lunch really looked like on the ground at these schools. And although the district had conducted a survey to determine parents' interest in a new program, they didn't have much on the ground observation directly with the children themselves. We also wanted to learn more about the parents' experiences and perspectives around school lunch. So we designed and administered an online survey near the end of the school year in June 2019, which was about 3 months after the program had been up and running as of February. We can't say exactly the proportion of families represented by the survey because we only had a rough estimate of the total families in these schools, but it was about 25% of the families from these 3 schools and just under 300 parents who had logged on to do the survey. Respondents, though, represented children at all grade levels, diverse socioeconomic circumstances, languages spoken, working status. So we felt it was a fairly good representation of the population of these schools. We also interviewed what we're calling stakeholders, 12 individuals who played key roles in the transition to the new lunch program. These were people in positions of authority to pass the school board motion and fund the new program, as well as those who were tasked with establishing the new program and people on the ground in schools where the programs unfolded, including school staff and administrators. So just to give you a sense of the 2 programs, we had this unique opportunity to document the experience of school lunch as one program was phased out and another came into be that was markedly different. So in the former program, parents signed up for a full month at a time, and there were few menu options. There was an envelope system for signing up, where parents would submit an envelope to the school indicating their participation. The envelope could be empty to indicate they were requesting a full subsidy, or they could put any amount of money up to the full cost of the meals for the month, which we were told was about $54 for a full month. And occasionally parents could pay less for a second sibling in some schools, but all of the meals for all participants were subsidized. Coordinating the daily operations of this program were 2 main staff members. One was located at an elementary school where quite a few students participated, about 55. And the other staffed a middle school and also prepared lunches for a small number of students at an adjacent elementary school. At the second elementary school, there was also a noon hour supervisor who helped distribute the meals. The meals were distributed differently in each of the 3 schools. In 2 schools where they had the main food service workers, students typically lined up outside the school kitchen to get a brown paper bag lunch and then return to their classrooms to eat with their classmates. In the school that didn't have its own dedicated kitchen staff, the noon hour supervisor placed the lunches in blue plastic bins that lined the main corridor. These bins were then distributed to the respective classrooms. As an aside, it was also common for families at that school to bring hot lunches right before lunchtime, and those meals were also put into the same blue bins that were delivered to classes. So the pictures on the slide here are both from our January 2019 fieldwork and were typical of the former school food program lunches. It was a highly subsidized program where the meals were below cost, and it was designed and funded with the intent of ensuring that children from low-income households had access to a meal at school. The number of meals available was based on estimates of need, and the program didn't have the capacity to serve the entire student body. So just to give you a sense of the new program was implemented in February 2019 in the 3 pilot schools, and it worked very differently. The school district hired a nutrition coordinator who was a registered dietitian who worked to establish nutritional guidelines, menus, and a contract with catering staff. The 2 kitchen staff were let go. all families at the schools could purchase food on a day-to-day basis through an online ordering process. The caterer delivered and distributed the food. There was a slightly different distribution method in each of the schools, but in at least one school, these meals were delivered to each classroom separately before lunchtime. And one of our district administrators referred to this as the Cadillac model. So the new program followed a cost sharing model where 50 cents from every full price purchase entree went towards the subsidy program. A full priced entree cost $5.75, and optional side dishes and optional drinks could be ordered for about $1.25 to $1.50 each. There was an online application process that was established where households could apply for a full or partial subsidy for the entree. With approval from the nutrition coordinator, the full subsidy or partial subsidies would make it so the entree cost either $2.75 or $1 or a full subsidy, and depending on the self-reported need of the family, but neither the drinks or the side dishes were included as part of the subsidy. So the pictures here show entrees that we documented during our fieldwork. Which brings us back to what our partners had hoped to achieve with this program. So as you can see from this slide, the district hoped to address many of the issues that we raised earlier, including a focus on improving dietary quality for all students, reducing stigma, and improving food access for low-income students, and reducing family burdens. We decided to focus our attention on children's meal experiences to understand what the program looked like on the ground and how students' experiences might be impacted by these changes to better inform evaluation and implementation strategies, and to see how the improvements hoped for by the program designers were really playing out on the ground in classrooms. And with that, I will turn it over to Seneca.
Thank you, Jennifer. Okay, so we're going to be focusing today on 4 main themes. And these are areas of potential importance for school lunch programs that we found proved challenging or elusive to actually achieve in practice. Areas where the original vision of the program came into conflict or didn't align with what some children and families experienced, or were overlooked in the original design of the program. These mismatches and tensions were related to stigma, to cost and access, supporting healthy eating, and what we've started calling the food care gap. And Jennifer's going to unpack that term in a little bit. These are developing ideas, and we're really looking forward to your feedback. So to start with reducing stigma, so this was an important goal of the district. And studies have shown that school food programs that are administered in non-stigmatizing ways are crucial for helping students and have access to lunch at school. But it's unclear how stigma actually manifests in programs. How might stigma occur? The research today emphasizes that stigma can enter into school food programs in a couple of ways at least. And one way is through the subsidy process. So we looked at this issue in our research. The new program's subsidy application, part of which you see on the slide, required parents to apply for a subsidy and ask that they indicate financial need, such that they, quote, struggle to provide a healthy meal for their children. So language such as this, requiring parents to attest that they have trouble feeding their children, can be stigmatizing. This is because food provisioning is a key aspect of what families are expected to do, and indeed held morally accountable for doing. My own research and that of others demonstrate that parents don't just feel like feeding their children is their responsibility, but they also worry about things like losing custody of children if an authority figure believes they're not able to feed them well. So the stakes are high. And more broadly, this kind of language can activate feelings of inadequacy and possibly stigma for not being able to feed one's child. Now, as I said, the district cared and worried a lot about stigma. In fact, stigma reduction was a major reason for introducing the new program. The district believed that families who needed assistance weren't using the former program because it was stigmatizing. So there was a general perception among the key actors that the envelope payment system and the fact that the program was targeting needy families made it stigmatizing. And that was because staff known to the families at the schools would be opening the envelopes and would know what people contributed, if at all. As one of our interview participants explained, there's all these mystery kids that apparently are hungry, but nobody knows who they are. The numbers just don't match. You wonder whether it's because you have a stigmatizing targeted program. If you get rid of that barrier, will all these kids start to pop out of the woodwork? So the idea was stop targeting needy families and create a program open to all. However, there was also a general sense that a number of families participating in the former program were doing so out of quote unquote convenience, not financial need. But this seemed to get lost in this dominant frame that the old program was stigmatizing. And in fact, those parents who were using the former program out of so-called convenience were characterized essentially as freeloaders. So the narrative was that they didn't really need the subsidized program, and this was a problem given that a lot of resources were going into running it, and it wasn't sufficiently serving the population it was targeting, those mystery kids that are hungry, as this stakeholder said. So a tension arose between stigma and a fear of freeloading and a need to stay in the black. And we saw this continue into the new program. So as noted, the new program also required families to request a subsidy and provide a reason for needing it. And stakeholders discussed concerns about stigma via the application process, but also fears of freeloading by parents who didn't truly need a subsidy. As one put it, the challenge is always the program has to be fiscally sustainable. So you can't have people subscribe for a subsidy that don't need a subsidy and just want to get a free lunch. Yet you don't want to create so much stigma that people don't apply. So here we have a key tension. The district saw need and value in school food program, subsidized for some, and worried about kids and parents feeling stigmatized for participating in the program. But they implemented a new program that would still require parents to state financial need to be eligible for a subsidy and substantially increased the out-of-pocket cost of participation. A number of parents who participated in the former program and reported in the survey that they believed they were eligible for a subsidy hadn't applied and had never or seldom ordered from the new program. In an open-ended comment, one parent wrote, "Many parents find the program too expensive and won't participate, but won't ask for a subsidy out of pride." The parent advised, just get over the stigma of asking, which can be easier said than done. And we're going to come back to this issue of cost in just a little bit. But if we go back to the original question, how might stigma occur? Another way that stigma can be involved in school food programming, according to the literature, is through children feeling visible as the poor kids on subsidized lunch. Research on the National School Lunch Program in the US, which has been running for many decades, for example, shows that when only those students who are eligible for free and reduced lunch participate in the program, rather than all students participating, this can be experienced as highly stigmatizing. And that's because it's believed those kids stand out as needing a free lunch, as the kids whose families can't afford to feed them. And the program becomes less appealing as students don't want to be singled out as needier or lesser than others. So given this existing research, in our ethnographic work, we were attuned to the issue of visibility. Do program lunches blend in or stick out? We found that students on either lunch program were relatively visible with some distinctions. So on the slide, you see a home lunch on your right, and on your left, a lunch from the original, oops, that might be on your right, sorry. Never mind, from the original program. Although noticeable, the former lunch program blended in quite a bit with the home lunches. Obviously, there are some compelling and clear differences, such as Tupperware versus foil wrap, and the ubiquitous milk carton from the meal program versus thermos or bottled drinks. Rarely did students with home lunch have a carton of milk. But the composition and packaging of the former program's lunches made them much more similar to home lunches. Now, with the new program, the entrees were highly visible in the classroom. We actually chose a photo of home lunch that we thought would downplay the differences because we didn't want to be seen as overplaying the differences. But typically, home lunch and the former program involved a variety of edible items, often separately packaged. In contrast, the new program entree was a single made container. So for example, in this photo, it's chicken and green beans that looked more distinctly like a catered or purchased meal than the previous brown bag lunches. To the ethnographers, at least, this increased its visibility. We often struggled to identify lunches from the former lunch program, but we had no problem identifying lunches from the new program. But again, both programs weren't just being used by low-income families. In fact, from the district's perspective, this was a problem with the former program. Not enough low-income families were using it, while some higher income families were. So even though the new program was open to everyone, during the pilot period, participation was low. Fewer than a third had reported ordering in the highest use school in May, and less than 1 in 10 were ordering in the other 2 schools. In fact, fewer students in the 3 schools were participating in the new program than had in the old program during our field work. There was also a big difference in the frequency of ordering and types of food purchased with the new program that could become markers of difference. All participating students basically got the same meal with the former program. With the new one, there were side dishes and drinks for purchase along with or instead of the purchased entree. So on the slide, you see a student who ordered the chicken and green bean entree and ordered a chopped fruit side dish. And if you're wondering about that weird label, each ordered item came labeled with the student's name and class number, which we had to block from the photograph because the lid hadn't been removed yet when the picture was taken. So a la carte items could be purchased, but the subsidy program covered the price of the entree only. That meant that sides and quote unquote treats, things like chocolate milk or desserts like banana bread or yogurt parfait, items that the students were often super excited about, cost money that those requesting a subsidy may not have felt they could afford. So this is another potential marker of difference that could possibly be stigmatizing. And because items were specifically ordered by and labeled for individual students, it was very clear who got them and who didn't. One group of students recalled being reprimanded for eating unclaimed food because it wasn't intended for sharing, even if the original purchaser was absent that day. The other marker of difference was the fact that people could order from the new program on an ad hoc basis, but those receiving a subsidy, perhaps especially the full subsidy, were more likely to be ordering daily meals. And our survey results suggest that most parents were indeed ordering lunches from the new program on an occasional rather than daily basis. But we also learned that students knew a lot about their classmates, including what they ate. This was the case both before and after the new program was implemented. So for example, during a 5th visit to a classroom, the field worker observed, the students throughout the room seemed to know who was, even who used to be and are not now, on the program. Is this stigma or just observation? Is it admiration from others or judgment? In other words, students knew who among them was participating in the program, regardless of whether it was the old program or the new program. But you can see we weren't really sure what to make of that. But it was an important lesson because even though the district worked hard to mask which children were on subsidy, our data suggests that efforts to hide information from students would likely be unsuccessful because of the in-depth knowledge children had about one another and their ability to read the clues that school meal choices reveal. But we will say that children, like adults, use their interactional skills to present their situations in a certain light. And we saw children working hard to conceal information about their situation that might be stigmatizing. And so we argued that there was some coded language in children's talk about food. And this might have been in an effort to avoid stigma. A middle school student, for example, who didn't have a lunch told a field worker, "I already ate." But later their teacher reported that the student didn't have lunch, and this was usually the case. So even though children knew a lot about one another, students were still working to present themselves in a certain light. But what we came to realize is that this can come at the expense of asking for help or receiving assistance. And we'll be talking more about this when we talk about the food care gap. So although the district was worried about stigma, it still seems plausible that the subsidy application process and some of the differences in food options may have meant that stigma was present in this new program. So the second major theme that we wanted to share with you today has to do with cost and access. Many scholars and activists promote the value of a universal school food program that mitigates the effects of students feeling visible and potentially stigmatized for participating. However, universal, we found, is an elastic term. The new food program offered through the external catering company, as Jennifer already noted, was labeled universally accessible. What program designers meant here was that every household that had a child enrolled in one of the participating schools could technically order food on a daily basis. However, cost emerged as a major barrier to participation and hence to the accessibility and indeed universality of the program. In the parent survey, over half of those who had not ordered from the program agreed or strongly agreed the price is too expensive. Few parents agreed or strongly agreed that the program helps us save money, is good value for the price, and is priced fairly. In written comments, parents often raise the issue of cost. For example, one parent wrote, "To tout this program as affordable for average, not low-income families is laughable. When our rent is double a mortgage payment, paying on average $10 a day per child for a lunch they don't like is absolutely ridiculous. I've met numerous families who feel the same way." So just purchasing an entree every day for a month would more than double the cost compared to the former program, from $54 to about $115. And consequently, the majority of the users use the program for only occasional rather than regular or daily use. And as noted earlier, lots weren't accessing it at all. Survey results also revealed some resistance to the cost-shared model and hence to the idea of collectively sharing the responsibility for school lunch. In particular, among respondents not receiving a subsidy, middle-income families were more likely than both lower and higher income households to disagree with the statement, part of a full-priced entree should go to support the subsidy program. And as a reminder, 50 cents of each full-priced entree went to the subsidy. So these middle-income families may assume that they don't qualify for a subsidy, but may feel financially squeezed, leading to lower support for the cost-shared model. And to make this even more complex, although students often said they weren't participating in the new program because, quote, their mom said it was too expensive, there was a strong culture of food as a commodity among students. Students often expressed skepticism about or even resistance to the idea of a free lunch. One student reported that she had heard good things about the new program, like you can get a free lunch, but I don't think it's true. In talking about the new program, some students said it shouldn't be free. So one student told us they would like the new program to be, quote, slightly cheaper, not free, not expensive, but a different price. And using identical language, another said the new program should be slightly cheaper, but not free. So this notion that food should not be free came up in other ways as well. Students involved in food trading in some of the classrooms discussed food like it was a commodity, describing its value. One student who was involved in a food swap loudly stated in class, "Nothing is free." Some of these kids were like fierce commodity traders. But these kind of comments and perceptions may have implications for stigma around subsidy. So our research suggests schools will have to address perceptions such as these, that lunch can't or shouldn't be free, if they hope to increase the likelihood of children and families participating in a subsidized program. And now I'm going to turn it over to Jennifer.
So this brings us back to the idea of healthy food and the district's original goal of ensuring that all children eat healthy. It's important to note here that there was a general sense among students and parents that the food offered in the new program was healthy. Taste, variety, choice, flexibility, time savings, and indeed nutritional quality were all raised as important perceived benefits of the new program. And 83% of parents agreed or strongly agreed that the new program provides healthy food options. We often found teachers and adult staff reporting improved nutritional quality compared to the previous program. So we emphasize here that from our photos, we didn't have a big enough sample to analyze the differences between the two programs in terms of nutritional quality. But like documented data from across the country, we found that many students' lunches have a long way to go in meeting national dietary guidelines like those put forward in Canada's Food Guide. So we're gonna share some insights from the 104 photographs we took of lunch. We note that we only photographed 6 students who ordered from the new lunch program out of the 53 we documented in May of 2019. So looking at all of the lunches, we found that over 50% of those photographed had no visible fruit in the photos, 40% had no documented vegetables, nearly 3/4 of the lunch photos had no evidence of servings of milk or alternatives, including fluid milk, cheese, yogurt, or fortified soy drinks. And only 1 out of the 6 of the new program photos had any milk or milk alternatives. So this suggests that for students bringing lunch from home or ordering school lunch entrees without the supplemental milk, even though we didn't do a formal nutrient analysis here, lunch meals are likely to be relatively low in calcium and vitamin D, nutrients of concern for Canadian children. And that's noteworthy since the majority of program lunches from the original program did include that carton of milk that Sinica mentioned. And none of the lunches, none of the program lunches before or after the new program had any evidence of legumes, and only 4 of the home lunches did, and very few lunches contained any fish. 85% of the home packed lunches and all of the previous lunches included more than 1 serving of grain products, but less than 20% of all the lunches contained any evidence of whole grain foods, and none of the 6 documented lunches from the new program did. On a positive nutritional note, only 1 photo out of 104 had a sugar-sweetened beverage, and that was a home-packed lunch. So while we emphasize that we can't draw too large of a conclusions from this dietary quality analysis, the preliminary analysis just reminds us that continued monitoring by a registered dietitian is essential for ensuring the nutritional quality of menu offerings. Considerations should continue to be given to ensuring improved access to fruits, vegetables, whole grains, and foods rich in calcium and vitamin D. So as noted, health and nutrition were a clear focus at the heart of the rationale for the program. And to support that quality, a school nutrition coordinator was hired and worked closely with the caterer to make sure menus met the BC Food and Beverage guidelines for schools. As part of the program's commitment to nutritional quality, the menus also assured that there was a fruit or vegetable included with every entree. There was additional fruit and vegetable side dishes frequently available for purchase, and milk and milk substitutes could be purchased daily. However, shortly after the completion of the pilot, the nutrition coordinator left the district, and no successor was hired to oversee the expansion of the program throughout the district the following year. There was an expectation that with the groundwork laid in the first year, the catering company would have the capacity to ensure dietary quality. And while the nutrition coordinator role was being rehired shortly before COVID-19 locked down schools, there were few apparent resources left during the second year rollout to monitor nutritional quality. Also, in the early stages of program development, program designers had aimed to incorporate food literacy education into the curriculum and envisioned a meal program that would work hand in hand with curricular strategies to improve children and parents' knowledge of nutrition and the linkages to health with learning outcomes. However, despite this early enthusiasm in nutrition education, the funding for staff and resources to support nutrition education to accompany the meal program, to our knowledge, never materialized. So overall, there emerged this mismatch between an ambitious goal to ensure that all students eat healthy and the reality of having few stable resources in place to support nutrition education or menu analysis and oversight. And while I'm a registered dietitian myself who cares deeply about the dietary implications of school meals, what came out here as possibly even more important is what the work is teaching us about how lunch is more than just the sum of its parts or the nutrients it provides. School food programs are ultimately about public provisioning of food, but also make us reflect on the ways that public institutions have a responsibility for care. In their decision to create a new lunch program with nutritious foods that all families had access to in a non-stigmatizing way, the school district was taking the initiative to focus on care by improving food access in students' meal experiences. However, by outsourcing that care to a private catering company, a care gap was created on the ground. One area that really wasn't an original focus for the design or an intended outcome of the program, and also wasn't something that we as researchers set out to document, was the way students benefited by the caring labor of people who provide lunch, and how school meals can be an important way that children feel cared for. Indeed, students often talked about food as care, whether that was being cared for by others through food or not feeling cared for, like not having your food preferences considered, for example. Students routinely told us about who packed their lunch, how much they appreciated when a parent packed something they liked, and they proudly described helping their family by packing their own lunch. So in our second round of field work, after the new program was implemented, students began telling us about how much they missed the staff who were in charge of the former program. Remember here that in implementing the new program, the former district staff lunch workers were known to students but were let go. So for example, a field worker spoke with a group of students, including one with no lunch, and wrote the following: "I don't see the student with any lunch," and he and his fellow students started talking about how challenging it is for students who don't have a strong support network. They say, quote, "Some kids don't have any food." These students were supported by the old program staff, and they felt like they could always go to the old lunch staff if they didn't have time or their parents didn't have time to pack a lunch. Quote, "Now you just have to starve." So this vignette points to the appreciation students had for the adults who had time and money, but note they didn't say that, to prepare their meals. School meals aren't just about food. They're also about nurturing relationships and connecting students with trusted adults, both at home and at school. Students also described how leftover items from the former program would be distributed around the school. Other students fondly recalled being able to do volunteer hours in the kitchen with the former staff. We also observed paper lunch bags from the previous program with personalized notes on them, and many students talked about the care and thoughtfulness of the kitchen staff in knowing them, knowing their preferences, and caring for them. This was all very much to our surprise because we focused more on the food and the classroom dynamics and hadn't given much thought to the role of the kitchen staff in the first round of fieldwork. If anything, we were concerned about the implications of children having to queue up for lunch, but we learned that many children enjoyed the interaction they had with these workers. We came to appreciate that their removal left a care vacuum that we're now calling the food care gap in the schools that was not acknowledged by the district. The new nutrition coordinator described working closely with the caterer and school staff at the 3 pilot schools, but had little to no interaction with the students themselves. We found that administrative staff and lunch hour supervisors tried to step in to fill the food care gap. As one office staff person explained, quote, "We assist with ordering where we can, helping set up accounts where we can, advising about subsidies. On a daily basis, lunch comes in. There's always some things to work out, some details to work out. So for example, the new program required parents to order meals through an online ordering system. And we learned through stakeholder interviews that some families receiving a subsidy were having difficulty ordering, so secretaries were sometimes doing this for them. But note the interviewee here says where we can. School staff were often stymied in their efforts to help by the bureaucracy, the online ordering system, the catering company, which we were told was often unresponsive, and the fact that staff members had no formal power in the new program because it was run external to schools. As one interviewee explained, we were on a previous lunch program where we could just make all of those decisions. It's very different now. So it can feel a little frustrating because it was so easily done before and now there's hoops. We just want to help people. We just want to feed the kids. Our interviews and observations demonstrated how school staff were trying to fill the food care gap as best they could in ad hoc ways. One school administrator we interviewed noted, quote, "A lot of us make sure kids would eat. No school, I believe, has ever let anyone not have. Every school has staples." And while in the new program, schools were ordering a small number of surplus meals each day to ensure there were extras available to support students in need, we found that without caring staff attuned to the individual needs of students, without the time and capacity on the ground to connect the dots, students were falling through the cracks. This kind of ad hoc care work is happening in schools across the country, typically without federal or provincial support. A recent survey in BC found that 40% of teachers bring food to schools for students who are hungry, spending on average $29 per month, and sometimes more. But this does not appear to be enough to fill the gaps. We saw students with moldy lunches, we saw students without lunch, we saw students with meager lunches. Staff on the ground felt powerless to help all the students in need, and administrators did not seem to be aware of these gaps. And so I'll leave it to Seneca to help sort of tie this all together for us.
I know we're running out of time, so I will just be very brief here. But in terms of what can we learn from this work, to create robust, non-stigmatizing school food programs, we argue that districts are going to need to gauge and address the concerns and values of parents and students. What do they think about the possibility of free lunch? How do they talk about subsidies and who should have access to them? And more broadly, our research points to the value of universality in practice, which means anyone who wants to participate can. And counter to the idea that there's no such thing as a free lunch, our work strongly indicates the value of making school lunch available free to every student, so everybody gets a meal at the middle of the day. This might sound pie in the sky, but there were a lot of complications involved in the new program, and the logistics of delivering meals that students could order on an individual basis was just staggering. And despite efforts to create low barrier subsidies, many who could have benefited still weren't participating. And those subsidized meals only included the entree, excluding sides and drinks, which had to be purchased. So, our work suggests we need to expand notions of need and access. The district was critical of parents who were using the former program out of so-called convenience, but my research and that of others shows that families feel under pressure to manage competing demands on their time and finances. At the same time, this research really does bring home the real cost of food and labor and the importance of meaningful support for school food programs. Healthy school meals were an important aim of this new program, and they rank high in national conversations about school food, as they should. But lacking stable resources in place to support nutrition education or menu analysis meant that a lot of this work was being done by the catering company without clear oversight, and no food literacy was being offered in the schools. And finally, we want to point out the crucial role kitchen staff, or lunch ladies as they're often called, played in knowing and addressing the specific needs of students. As Jennifer said, symbolically, food is care. This is what we learned from the students. And the caring work of feeding others needs to be recognized, valued, and supported, not pushed to the margins or left to the extraordinary efforts of a few who go beyond their mandates of their job to try to fill what we're calling the food care gap. So we hope that these insights will both enhance the work school food programs are doing across Canada and spur legislative change to meaningfully support school food programs going forward. So thank you all for listening. We also wanted to thank the parents who did the survey, stakeholders and families in schools who graciously let us learn about school lunches that happen, Professor Rachel English Stringer, local health authority, the school district, and our wonderful research assistants, Rachel Mazak, Amber Huckelman, Seti Nimi Birch, and Iris Lopez Ramirez, as well as our funder. And thank you all for listening. If you have any questions or comments and we don't get to them today, feel free to email us. I'm going to now hand it over to Addie. Thank you.
Awesome. Thank you so much for sharing all of your research. That sounds like a really long, I don't know. It's like, it's nice to like find things at the right time, and then you get to research the before and after. And it sounds like you got some really awesome results. So we have lots of questions. So I'm thinking, you know what, we'll just go to 4:45. Are you both okay with going a bit later?
I'm happy to stay until small children invade my small space, but
Perfect.
If people want to stay on the line, I'll stay as long as people want to stay around.
Okay. Are you okay to stay on a bit longer, Seneca?
Yes, that's fine.
Okay, great. So we'll probably go maybe just to 4:45, and if you need to leave, go ahead. But it'd be nice to have a bit of a discussion here because there's lots of questions that came up. So there was a few questions about it. It's something that I'm interested in for sure, about food acceptability and food waste. Did you notice any differences between what was thrown out in the packaging and everything, as well as the food itself, between the new program and the former program?
Seneca, shall I take that?
Sure.
So we didn't explicitly have a protocol for sort of formally assessing waste, so we don't have great data on that. Waste was definitely something that did come up on the parent survey and at our discussions. So, I mean, it seemed in general like a similar amount of leftovers were found before and after. So that's sort of the best quality data we have. There was also ongoing discussions about sort of the cost and risk of the meals. So the school district had a very clear policy that discouraged keeping leftovers because of food safety issues. Right. We did see students who did appear to be taking those foods home, and parents on the survey reporting that there were leftovers. So one of our continued points of thinking was even considering how might safe storage, if at all, be possible, because we know that it's a concern for parents if they're going to spend the money on food. They want to make sure both that their kids are going to enjoy the food. Some parents reported students needing to have leftovers for after-school programs and long days. So, and also waste comes in two forms. So there's the question of the leftover food and also the packaging waste. So the district was trying to address the issue of trying to come up with a compostable and sort of the least waste generating packaging. But as you can see, the foil, if you got to keep things warm, these were major logistical challenges to making this work in an external delivery model.
And did those just go in the garbage then afterwards?
Seneca, do you remember? I believe.
No, so every school had a compost bin, a garbage, and a recycling bin. I remember doing field work in one school, though, with the sign for the garbage and the recycling had gotten mixed. And so students were putting all the recycling in the garbage. And so there was protocols in place for dealing with the recyclables. Obviously, not everything was recyclable, and not always ended up in the places where it was meant to be.
Yeah, well, it's probably up to the teacher a bit too, but at least there could be a practice of washing and recycling the tin.
And we note the teachers were seldom actually in the classrooms at lunch. There was occasionally noon hour supervisors that would float in and out, right. But I would say, wasn't sufficient adult capacity to really keep an eye on that.
Okay. And was there vegetarian, vegan options? Because it looked like there was lots of meat, which is always nice, but were there other kind of choices?
I believe there was a daily vegetarian option available every day. We didn't have the ordering logs, and we didn't see sufficient meals to sort of get a sense of whether students really were ordering them. But I think that was a sort of a key value to try and make sure there were those options.
Okay, great.
Yes, they made sure that both a vegetarian and a non-vegetarian option were available.
And we had a question about the time frame of the pilot program. How long did the nutrition coordinator stay in the position in terms of the planning and implementation phase?
So I really give if she's listening, my great admiration for the nutrition coordinator who came on board. It was a really short time frame. She came on board in the summer of 2008. The program launched by February 2019, and unfortunately she left. She moved out of Vancouver by the summer of 2019. So what they actually were able to do in that very short time frame was quite amazing, given that they found the caterer and launched in that short time. And by September of 2019, they had rolled this this program out to the entire district, and they were in the process of rehiring, right before lockdown. And I haven't followed up, but I imagine so much has changed since then.
Yeah, COVID changes lots of things. Stephanie is wondering if there were other opportunities for parents or other community members to be involved as volunteers in any capacity.
I don't remember much volunteer capacity from the parents. Seneca, do you have any more light on this?
I don't, not from the fieldwork we did in the schools. Certainly the parents were involved insofar as the catering company brought tastes from the menu to a few of the PAC meetings, and parents had an opportunity to meet caterers and talk with the chefs and taste some of the foods. But in terms of on the ground in the schools, it was mostly just seeing parents who were dropping off lunches from home. And there seemed to be more formal roles, although in one middle school, I was surprised when a student said, "Thanks, Mom," when a noon hour supervisor dropped off a program lunch. And then he grinned and said, "Well, my mom's that was my mom." Because I was like, did the student just misspeak and just assume that's your mom giving you food? But he clarified, and I don't know whether she was volunteering or not. So she may have been an employed noon hour supervisor.
Okay.
And also just reflecting on the many politics and logistics of these programs, I know they did work closely with the PAC fundraisers, because as many schools have, lunches are also used as fundraisers. So I think they did sort of work out some agreement so that there could remain PAC fundraising initiatives that remained going to PAC, despite the fact that the lunch program was available every day.
Right. Okay.
They didn't want to compete with parents.
We have a question wondering about how the hot food product was held.
So they did have warmers. I can't remember the food service terminology for how they did that, but the food did get delivered, quite immediately before the lunch period in most cases. And Seneca, do you remember the name of that warming case with which the hot entrees were distributed?
I think they were called Cambros, but that might have been the brand name. But I think the distribution method has changed. It was quite time consuming during the pilot program, but the caterer was really committed to trying to make sure that things went smoothly on the ground. And because there weren't a lot of meals being ordered, this was possible. So they were delivering using a van and these Cambro warmers to each school. And actually in a couple of the schools, those meals were going directly to the classrooms.
Okay. Rachel is wondering how menus were curated. Were children surveyed for their needs and wants, or was it strictly created on a nutritional guideline?
So these were things that I think we documented in depth. Certainly there was a nutrition coordinator in place, and she was working very hard as the go-between between the caterer and the district to try and come up with menus that met the school BC food and beverage guidelines. But they wanted this program to be successful, so they were trying hard to find a balance of food that was nutritious and appealing. They did taste tests. I'm not sure above that how much sort of direct surveying or feedback they were doing about menu development.
Yeah, I agree with Jennifer. We didn't catch much in regard to that, although I know that some of the students were being interviewed about their opinions about the menu and what they had tried as the program was rolling out. But I'm not sure. My understanding was that wasn't exactly a survey or a systematic form of information gathering.
Yeah, I guess it's kind of hard for proper research maybe to be done with students.
And we didn't follow data collection beyond the pilot schools, but they certainly were responsive to feedback from the parents. So in the major rollout, they'd, for example, implemented 2 different sizes of entree, a smaller and a larger at different price points. So they were trying to listen to the feedback from parents and children.
And then our next question is about food literacy. I was kind of, you mentioned it, that it wasn't offered like in conjunction with the pilot program. Do you know if there were any other like classes that were just doing it in school? And then we have another question is if the kitchen, if the schools had any kitchen facilities that were not used anymore after switching to the catering, or was that still used? Like what was kind of happening around that?
And we didn't formally assess sort of the nutrition literacy components district-wide beyond what we were sort of seeing or hearing from either parents, school stakeholders, or in our process discussions. We worked closely with a health authority, public health dietitian, who I'm fairly certain was engaged in other district communities that were trying to put forward nutrition education work. So I'm certain there were some ad hoc things happening in some places like we see in lots of our schools, but there was this original idea that there would be a truly coordinated linked effort where there'd be nutrition education linked to the meal program, and to our knowledge that never got off the ground. I didn't hear of anything sort of happening in those kitchens that sort of moved in when the meal programs moved out, and that seems like an excellent idea. I just don't think they had the chance to get there.
Great, thank you. Seth is wondering if cultural differences between families affected their willingness to use the programs?
I'll handle this question. It certainly seemed as though from the parent survey that some parents felt that the foods being offered weren't going to cater to their children's specific taste buds. But that was from a range of different concerns. A lot of parents thought that the new program food wasn't kid-friendly enough and asked for simpler, more kid-friendly things like hamburgers and hot dogs. Other parents said that, you know, some of the ethnic foods that were being made available were like really, the kids were really excited about it and they were popular items in their household. And yet other parents said that they felt that the menu was too Western and they didn't see things on it that their children with their ethnic heritage would choose to eat.
Right, okay.
And one of our key findings that, you know, we could have a whole other talk about was about the vast diversity of things we saw in the classroom, both in terms of what students brought, how they ate, what they liked, what they did. So we recognize how enormously challenging, you know, simple things like choosing the menu are to cater to this extraordinarily large range of tastes and preferences and ideas about what a good lunch looks like.
Yeah, there's a lot involved.
This was partly why we thought food literacy would be so important to accompany any school food program, because it would really help to address like some of parents' concerns about kids not wanting to eat the food, and also would be a reminder of thinking about diverse approaches to meals and diverse ways that children might want to participate in a meal program. And we also thought that the food literacy would be a great way to address this issue of food as a commodity. And so it could include information about, you know, food as a right and the value of access to food for everyone, so that students might begin to understand a little bit better why, you know, school lunch could or should be free.
Yeah, that's really interesting. Danielle is wondering if this work is published, that they're seeing similar care data in Ontario.
It's not yet. We wrote a very long report that has gone to the district that we hoped to make public right before the lockdown. We are putting the finishing touches and do want to release it soon. If somebody really wants any snippets or pieces, let us know. We're going to write probably several papers on it and do as much public dissemination of the core messages as we can. But what, we originally intended a sort of 3-page report to the district, and we have at least 50 pages written and probably could have done a triple report. So from this small project emerged so many things. So school food is so much bigger than it seems.
Yeah, well, I think that's like a lot of research. There's always more to look at and more to think about. Sorry to interrupt you there, Seneca.
I was going to say to the questioner, please get in touch because we'd love to hear about your emerging care findings too.
Wonderful. So will this report go to the district or going to the board as a public institution?
So the report has gone to the district. They saw sort of several drafts as we wrote it because they were key partners in our research process. We had really hoped to present it in person. We were meant to confirm our district board presentation date, I think March 9th, and unfortunately, I can't imagine they're going to have room on their district board meetings for this for a while. If anyone from the board is listening, we're still happy to present directly to you if you have time for us, but I don't see that being possible soon.
Yeah. Well, hopefully next year. This is really important research. Okay, we'll do one more question. How was the menu designed in the absence of the new Canada Food Guide for menu planning professionals? Is dairy still considered to be a food group, or alternate non-meat proteins included?
Yeah, so interestingly, the food guide came out in February, the same month as the program launched. So I think they were using the BC Food and Beverage vending guidelines more as the framework. So we were not there as they, like many people in school food, are going to try and interpret the new food guidelines. I'm interested to see how everybody does that. Particularly around questions of milk and milk alternatives.
Yeah.
And just to address the last question I just saw come up, we don't actually know what's going to happen in fall 2020 because our partnership has ended, so we're not collecting those data anymore. But we were intrigued to learn that when the schools closed, the catering companies also closed and stopped providing meals to the school. But actually the secondary school that had an in-house school food program stepped up and started making meals that were then distributed to families throughout the district.